Hey there, everyone. Greetings from sunny Florida. My name is Emily Sproul. I am the Executive Director of the Shenandoah LGBTQ Center. I'm sorry I can't be with you this morning. I am in Florida for a week-long training aimed at equipping executive directors of LGBT centers across the country to be more effective in the work that they do. I'm looking forward to seeing you next week as we begin our mural collaboration for Permeable Borders. Some of you may be wondering why there is a Q on the end of our name, the LGBTQ Center. Q, of course, stands for queer, which for many decades was used as a derogatory term to describe gays, lesbians, and others who did not fit the heterosexual cisgendered norm. Cisgender meaning that you identify with the gender assigned to you at birth based on the features of your external genitalia. The term queer is now being reclaimed by the LGBT community as an umbrella term that broadly describes a rich diversity of sexualities and gender expressions, including transgender and non-binary people, intersex people, and asexual or aromantic people. When used with respect, the term can be helpful in including these diverse identities. But obviously, if used in a negative context, the term still has the power to hurt and alienate LGBT individuals. I wanted to give you a brief history of the center this morning, brief because we've actually been in existence for less than a year. We were founded in July 2018 by Christopher Wood, who's with you this morning. Chris recognized the need for an LGBT center because there was no full-scale center to serve this population within a 90-mile radius. The closest comprehensive center is in Richmond. There really has been no coordination of services for LGBTQ individuals in the Shenandoah Valley, and the center is intended to serve the valley north through Rockingham and Page counties, south through Rockbridge and Bath counties, and west through Highland County and even into West Virginia. The center really began with a listening session in September of 2018 to hear from the local and regional LGBTQ community about what services and programs we need here. The first thing that we identified was that peer-to-peer support was incredibly important. It was one of the easiest programs for us to put in place, and we began holding those support groups in October of last year. We didn't have a space at that point. We were borrowing space from Chris's organization, LGBT Tech, which was at that point centered at the Stanton Hub. And we collaborated with the Arrow Project and Sabrina Burris, who will speak with you this morning, to facilitate and deliver mental health services in a peer group setting. Sabrina is going to tell you more about how that works and what kinds of themes have emerged over the course of the last 6 months. So I will let her go into more detail about that. Social events were also a priority in that we heard in that listening session, giving the community a chance to gather and meet new people and enjoy food and fun. And so we've done a couple of social events over the last 6 months. We held Friendsgiving in November, particularly to reach those who don't have families to spend Thanksgiving with. We had a gathering the Saturday before Thanksgiving where we enjoyed a potluck meal of all sorts of seasonal foods and had some really great time to just be together and celebrate together, particularly for those who feel really isolated. We also held an open house at our new space in February and welcomed lots of not only LGBT folks, but also allies from the community, and had a great time meeting people there. And then we had a potluck and game night at the end of March that was just pure fun and well attended, and probably one of the more popular activities. So potlucks are probably going to be a regular part of our social programming. We're continuing to develop our social programming with the help of Mary Baldwin's student and also center board member, Jay Cropper. Jay is helping us with ideas for our drop-in hours on Friday evenings, whether that's open mic, poetry slams, and a number of things, and also looking at developing a story time for kids, possibly a drag queen story hour. Lots of exciting things coming up with that. In that listening session, we also recognized that there was a need for outreach and training with local schools and employers to help educate the community about issues that the LGBT population faces. We serve youth, adults, and elders. Each group, of course, faces different challenges, whether it's access to education, social interactions, bullying, workplace and housing protections, access to public spaces, and the availability of elder care that is sensitive to LGBT needs. Keep in mind that these groups all came of age in different eras when being out or being closeted had different ramifications. But of course, for this project, we're focusing on the youth experience. One of the most cited statistics is that LGBT youth are at a much greater risk for suicide than their cisgendered heterosexual peers, as much as 3 to 4 times as likely to self-harm or commit suicide. You can imagine with the normal teenage challenges with school and peers, compounding that with your LGBT identity, which may or may not be supported by your friends or your teachers or your staff and family, can create a lot of stress. Many more teens are now identifying as LGBT in middle school. They're coming out in middle school, or at least recognizing it in themselves at an earlier age. And that's a particularly difficult time in their social development when their peers are more likely to reject and or bully them. National studies have shown that family acceptance and support is actually the biggest factor in reducing the risk of suicide and self-harm. To the point that youth who feel accepted and supported by their families are basically indistinguishable from their cisgendered peers as far as their suicide risk. But unfortunately, many of these youth don't feel safe in coming out to their parents for fear of rejection or abuse or homelessness. And many LGBTQ teens who come out to their parents find themselves homeless upon high school graduation, if not before. Their parents kick them out and they are on their own. Now, not all of these homeless teens are necessarily living on the streets. Particularly in rural communities, many of these youth will couch surf with friends or extended family, sort of floating around between households where they can crash and spend the night, maybe get a meal. Some of them are living in their cars. Some of them are finding themselves in really risky living situations where they're caught up in drug use and or sexual abuse. We offer specific support groups for youth and families. Those groups give them the opportunity to talk with peers about their experiences, develop healthy strategies to confront the stress in their lives. The family support group is also a safe place for family members to come and share their experiences and their struggles with trying to be supportive and cope with rejection from other family and friends. But sadly, the youth that need the most support from the center are the youth that are unsupported by their families, and they are also the most difficult to reach. They have a lack of transportation to get to the center. Those that are under 14 need parental consent for counseling. It's difficult to get them to events or groups without them being dishonest with their families about what they're doing. And then we've got other challenges that are specific to the Valley and the context here in the Valley. We cover a large geographic area. Augusta County is one of the largest land areas of any county in Virginia. We have little access to public transportation. That rural context and high rates of poverty increase the isolation of our youths. Kids who can't afford a car aren't going to get much of anywhere. They're going to be stuck where they are and relying on family or friends to get them where they need to go. This area is also essentially part of the Bible Belt of the South. Conservative Christian values make family rejection more likely, and there are fewer accepting faith communities, which means less of a support network for youth. And many local school systems do not have specific programming to support LGBTQ youth, and abstinence-only sex education programs fail to adequately address the needs of LGBT youth. So things that we are focusing on to try to reach these kids are things like outreach and training for local schools and for mental health professionals in the area who can help support these youth. And reaching those more rural populations is also going to depend on a robust digital presence for the center through social media, through web resources, and hopefully through telehealth programs. So those are just some of the challenges that face the youth that you'll be working with. Sabrina's going to talk with you more about what we're learning through working with peer-to-peer support groups. And then Chris is going to talk to you a little bit about the importance of our first Pride celebration last fall, what that meant to our community, as well as his crucial work with the Power On program that aims to bridge the digital divide. In closing, I just want to say, as the mom of 2 queer kids, this work is near and dear to my heart. I look forward to seeing you next week, to introducing you to some really fantastic youth, and to us all working together to make a really beautiful project that expresses the queer youth experience in the Valley. Thank you so much.